NPT reports, aging matters.
There are some historical events that have led to systemic bias in healthcare and patients being unsure if they can trust the medical system as a whole.
American medicine has a deep-rooted, troubled racial history. For example, the Tuskegee study that began in 1932 using black sharecroppers without their knowledge. The men were diagnosed with syphilis and were not given treatment to see how sick they would get. And the case of Henrietta Lacks, an African-American woman whose cancer cells were collected in 1951 without her consent or payment. Her cancer cells to this day are one of the most important sources of medical research data. The history of medical abuses include unwilling and sometimes undisclosed experimentation, sterilization, grave robbing, and malpractice linked to social Darwinism and eugenics. And present-day incidents continue to create distrust and hesitancy among some patients of color.
This was the second worst day. A doctor wanted to send me home. I was in so much pain from my neck. My neck hurt so bad. I was crushed. He made me feel like I was a drug addict. And he knew I was a physician.
Dr. Susan Moore, a 52-year-old family physician, posted this selfie on social media from her hospital bed in Indiana. The video went viral as Moore alleged substandard treatment due to her race.
This is how black people get killed. When you send them home and they don't know how to fight for themselves.
Moore died a few days later from COVID-19. An external review by the hospital where she was treated found, in part, that cultural competence was not practiced by all providers, and several caregivers lacked empathy, compassion, and awareness of implicit racial bias.
There was a study published in the American Journal of Public Health that looked at 15 studies looking at implicit bias in medicine. And they said, yes, physicians tend to have a negative bias towards blacks, a positive bias towards white. It impacts treatment decisions and it impacts patient outcomes. We need to create systems that help to ensure that the way care is delivered is consistent across the board. But we also need to listen. We need to listen to our patients.